Thank you very much. Good morning, good afternoon, and good evening, everybody from the Global South and North. Today, we are dealing with a webinar on decolonizing aid. Others take turns to introduce themselves. Her Excellency, ma.
Yes, my name is Adenika Grange. I'm a professor of pediatrics, retired, and I'm currently the chair of the of NUCAN, which is the Nigerian Universal Health Coverage Network. And it's under that umbrella that I have been invited by Mrs. Igbine to be a speaker. Thank you very much.
Good afternoon.
You're
My
welcome,
name is Ambassador Mohammed Ngubdo Hassan. I'm the chairman of the Governing Council of Nigerian Universal Health Coverage Action Network. I am a retired lecturer from the Polytechnic, called Ramat Polytechnic in Maiduguri. Maiduguri is the hub of the Boko Haram insurgency. I've been there since the problem started to date. My nomination to participate in this webinar came from Lizzie Bine of CI. So I'm very happy to be here. Thank you.
Thank you very much, Ambassador. I can see that Professor Anna is here. Sir, can you introduce yourself?
Thank you very much. My name is Joseph Anna. I'm a professor at the Africa Center for Clinical Governance, Research and Patient Safety. We're based in Calabar, Nigeria. We cover the world from here. And I'm a member of the Board of Trustees of NUCAN, and the chairman of the subcommittee on research and documentation. I'm glad to be here. But I think we have a keen interest in the topic that is being discussed today. Thanks for having us.
You're welcome, sir. Madam Bisi, is Pharmacist Bisi here? Yes, she's here. Hello,
yes,
ma.
please. Good. I'm here. Good afternoon. Hello.
Can you
Hello,
introduce
Madam
yourself,
Bisi.
ma?
Oh, I'm sorry, please. Good afternoon. I'm Bisi Bright. It's a privilege to be here. I'm CEO of Live Well Initiative out of here in Nigeria. And it's a privilege to be here. We're going to be talking about aid, and the Live Well Initiative is one of the non-profits that is not aid funded and has never been aid funded. Thank you. I'm happy to be here.
Thank you very much. Can we have other people introduce themselves? I can see Mr. Martins here from the Global South. Sir, can you introduce yourself? Hello?
Is it me you wanting?
Hello?
Hello, I'm Martin
Yes,
Drury.
I think it was Mr. Martin Drury, she said.
Ah, okay. Yes, thank you. I'm
Yes.
Martin Drury. Thank you. I'm Martin Drury. It's good to be with you. I work for Health Poverty Action, and I'm joining you as a guest. It's a great privilege to join you. I'm based in the UK.
Okay. Thank you very much. Who else have not introduced herself or himself? Have HPA. Hello. Mr. Hamimu, have you introduced yourself?
Hi. My name is Hamimu
Hello.
Masodi. My name is Hilal Masodi, and I work with Health Poverty Action, and I'm also a member of the Kampala Initiative and a coordinator of the Track Change Initiative, a subgroup of the initiative. I am happy to be with you. I'll be working in the background, just making sure that the technical aspects of the webinar are okay. Thank you very much, and you're most welcome.
Thank you very much. You will hear of a common word, TCI, is Track Changing Initiative. It's an initiative of the Kampala group that met in Kampala in 2019, and it's about how do we decolonize the might that is surrounding age. Age is what the global north give to the global south as in form of support. For today, we are having 5 speakers, 4 from Nigeria and Mr. Martins. The speakers will have 10 minutes each to speak, but we have a speaker that will speak more than 10 minutes, and that person is the first speaker, and she will make an introduction, and she's our keynote speaker. She's in the person of Her Excellency, Professor, Honorable Minister, Mrs. Adenika Grange. She has over 40 years experience in pediatrics. She's retired but not tired. She was a former Minister of Health in Nigeria, and she has led many groups, including as being the BOT chair of NOCAN. And NOCAN is Nigeria USA Action Network. It's an organization that is dealing with the issues of health in Nigeria, especially in closeness with UAC. UAC is Universal Health Coverage. So she's going to give us a keynote speak for 5 minutes, and she will present her papers for 10 minutes. So she's going to take 15 minutes to do her theme. And her topic is, she's introducing, framing what is age, the benefits and failures of age. And she's going to give us an overall the strategy on how to decolonize age. Honorable Minister Ma, you have the floor.
Thank you very much, Mrs. Igbini. Oh, it says I cannot start the video because the host has disabled it. Is that possible? Okay, well, we just speak then. I always prefer to be seen when I'm speaking, but anyway. Good morning, everybody. It's morning here, very early in the morning. And I feel a little bit handicapped because my laptop has refused to work just now. It's saying that the network has a problem. So I'm speaking from my phone. I'm just too grateful that I have an alternative to speak from. So you are welcome, everybody. Thank you very much for inviting me to speak on this very important topic, aid. It's an old topic. It is a topic that we had taken for granted for a long, long time. And we had used aid without even knowing that we were using aid in many instances. And we were, in those instances, we were not even tracking the outcomes, the outputs, but here we are. Over the years, aid has become a big, big subject for us. And we've been inundated by loads of NGOs who have come to Africa to help us realize our objectives of national development and particularly in reducing our very high mortality rates. I believe that we are all here today because it is an intersectoral subject. And this is one of the reasons why organizations like NUCAN are needed in Africa, because it is intersectoral. The aid is given different forms to different sectors, and it needs to be harnessed and integrated into the resources of the country itself before we can realize the benefits. Unfortunately, over the years, we have failed to appreciate or to harness the true benefits of aid. And because of that, it had become a big monster in some instances. It had caused us to deviate from our plans, from our goals. And we were now ready to chase the work that the aid is helping us to perform. And for example, in humanitarian aid, we would, yes, make sure that we organize ourselves to reduce mortality from disasters, etc. But beyond that, we do not get back to the true work of national development. And this is why the benefits of aid has not been sustainable over the years. It is unfortunate. You find that our outcomes are like a roller coaster type of report. When we apply aid, the problems get resolved, and then it comes back, and we have to apply more aid. So it's important to know this kind of pattern, so that when we discuss today, we want to come out with a kind of solution that will give us a sustainable platform for utilizing aid in the right way, and for ensuring that it is only used as maybe a catalyst and complement, and not the actual resource that the country should rely upon. With this short introduction, I thank you for inviting me to give my first paper, to be the keynote speaker. But I wish to ask permission from Professor Anna, who has told us in confidence that he is really hard-pressed for time and that he would like to leave shortly. I don't know if Professor Anna will be able to give his paper. First, I know, yes.
Sorry, Your Excellency, I had sent you a private mail. I guess you didn't see it.
No,
I thanked you for that consideration, but I said I had made some adjustments. So please, I'm happy for the program to continue as planned.
Oh, thank you very much.
Thank you.
Thank you. Thank you, because thank you. We would have tried to accommodate you, because we didn't want to miss your paper at all. So that being said, I would like to start my own keynote or my overview presentation with the help of our technical supervisor, Amimu. If you will please help me to show the slides. I am so happy that we send the slides to you, because right now I cannot even show my slides from here. So thank you very much indeed. Okay. Now, this is not the first slide actually. Would you please look at it properly and show me the first slide? Thank you. Right. Okay. I think we can move on quickly to the next one. That's just the title slide. Right. So what is foreign aid? What is aid? It is any type of assistance that one country or international organization voluntarily transfers to another, which can take the form of a gift, a grant, or a loan. Countries may provide aid through capital, food, supplies, and services such as humanitarian aid and military assistance. Next slide, please. I want to start by giving a brief history of aid, simply because I was party to this history. At that time, I did not realize that it was a form of aid that got me to begin my education in secondary school, as well as in England. So if you look at this history, there was the period of colonialism when the various European powers carved out Africa for themselves. And you know what they did? It was a way of getting some resources, raw materials from Africa. But at the same time, some of them did settle in Africa, and some were coming to Africa in rotation to give of their expertise in education. And so it was education that really got the big slice of aid to begin with in Africa. I think it was just fortuitous, really. But there you are. And the models of this could be found in universities, two universities, the University of Forobe in Sierra Leone and the University of Ibadan in Nigeria. And subsequently, in the post-colonial period, we young ones, I was a child then, began to get into secondary schools, and the United Nations decided that our countries should actually become independent after a while. And one way of preparing us for independence was to make sure that we became educated. And that was really a great thing on their part. So Nigeria became independent. Next slide, please. In 1960. The next slide, please. And Nigeria became independent since 1960. If we want to find out really what has happened since then in terms of education, let us take education for a start. A lot has happened because our leaders then took education very seriously, and they mandated that children should go to school and made schooling free. So at least the primary school was free and secondary school was cheap. So by way of my own personal history, I benefited from that because I got into a good secondary school, Methodist Girls High School. However, no matter how good it was, it did not have the laboratories that were needed to give us a good scientific background. And by that time, I had made up my mind that I wanted to be a doctor. So my father, did some self-sacrificing and decided that I was to go to England to finish my schooling, my secondary schooling there. And that was it. Of course, I could see the difference because the scientific aspect of education was really quite elaborate. Now, why was aid changing in complexion gradually from education? First of all, the economic status of both the donor countries and the recipient countries was changing. And then there was also the changing global philosophy of aid. Can I have the next slide, please? The first time that we were benefiting from aid, those who visited, those who came into, those with whom we came into contact were mainly Christians who left their homes to come and teach us, and they wanted to spread Christianity and the British culture. And then subsequently, after the World War, the Western political and economic democratic philosophy took over. And particularly the US wanted us to embrace democracy in place of communism, which was being peddled then by Russia. So that was one reason, that we were taking into consideration for aid. And then there was the eradication of infectious diseases like filariasis, tuberculosis, malaria, HIV/AIDS, later on Ebola and COVID-19. But earlier, those diseases were also affecting or would affect those Europeans who decided to come to Africa. And particularly at the time when the military people were around, and the malaria obviously was not to be tolerated at that time. So there was a great rush to help us to get rid of these diseases. And I'm sure you still remember President Carter, who took on filariasis as a special issue. Then the next reason, which is most recent, is to expand their markets to us, expanding global markets. And this is when we now started having a rush by various NGOs to come into our country, Initially, it was just the UN NGOs, UNICEF, WHO. Remember, with UNICEF, of course, we directed our goal towards reducing infant mortality. Next, please. So what went wrong, with all this aid being given and we trying to develop? Well, obviously, everything will depend on the type of governance that we ourselves adopted. We had to include everybody for fairness and equity among the various diverse groups. And I will show you a map soon that will tell you how very diverse we were, or we still are. And so it's very difficult to give equity to such a diverse group. There was also over-centralization of political and economic power. That was the kind of governance that we decided to adopt, federal governance. And it's still like that today, till today. This led to instability, insecurity, and tribal warfare. And of course, deterioration in political, economic, and social development. Next slide, please. So this shows us two maps of Nigeria. The first one, I think, I cannot see it very well now, but I think the first one is showing population. Yeah, it's difficult for me to see very well. This is where I am a bit handicapped because I'm using my phone. It shows the population distribution, the demographic distribution, which shows that there are more children, more youths in a country such as ours. So the resources needed to be directed more to the youths. Then the other one, I think, I cannot see at all what it shows, but okay, here we are. Poverty, the poverty line. You can see that a map that is showing inequity, really. Poverty line is highest in the northern part than in the southern part. Next, please. Next slide. This slide is just a quick one to let you know what we did with our aid between 1960 and 2015 in the health sector. Under the Millennium Development Goals, we tried to reduce the infant mortality rate and also the maternal mortality rate. But this shows very clearly how infant mortality rate came down by about 50%. Next, please. So what are our current needs for foreign aid? Human resource development in technology and innovation within the country. This has become an acute need for us because we are getting left behind here. We still enter our data manually, no digital form of entering data. We still consult physically, although there are attempts being made now to do to start digital consultations. Why do we have to do this? Because it is very difficult for us to reach into the rural areas physically now. The infrastructure is not there. So if we can have the digital infrastructure upgraded and updated, we may actually be better off. We may be able to use better whatever aid we are getting. So the internet is very important as far as getting aid is concerned. Infrastructural development, roads, train, everything, that we've been talking about. But the maintenance of this form of development is so high that, it leads to non-sustainability of our form of development unless we really focus on ensuring that we keep the funds for maintenance. We keep the funds aside for maintenance. Strengthening the fiscal policy formulation and implementation. This is behind, it is really the foundation for use of aid. Unless we are able to generate our own resources through taxation, through, getting our resources into finished products. Yes, we have oil, but the oil we have not been able to make good use of because we've not been able to process it to finished products. So, we are still selling it at very cheap price because it's a raw material. Raw materials are bought at very cheap price. So our fiscal policy is very, very important in this. And this will reduce our dependence on foreign aid eventually. Bridging the gap between products of local creativity and innovation and scaling it up to marketing stage. This is something that economists know a lot about. And as far as they are concerned, we are not doing a lot with that process right now. And we should also ensure that there's fair trading of local products in the world market. Next slide, please. So this brings me to saying why we should reposition and why we should now, or how we should also reposition. So we need to know what kind of aid we want with inputs of all stakeholders. And the best aid is one that leads to development in the recipient's country. And there should be collaboration and cooperation with the people, private sector, and the public. There should be collaboration with Nigerian professionals in diaspora. Yes, the number of Nigerian professionals in diaspora would knock you flat out when you know what they're doing in diaspora. We must find a way of harnessing their own strength in the diaspora and maybe give them a way of connecting with their country at the time that they choose to connect and be able to get out when they want to get out, but give of their best when they are in the country. We should collaborate and cooperate with other African countries, the AU, through AU, and other institutions, other regional institutions, enhancement of negotiation, diplomatic coordination, and promotional skills. This is something that we have to focus on now. Thank you. Next slide, please. So it's with a view to reducing our poverty and income inequality. There is now poor leadership. The leadership that's needed is one that can harness the natural and material resources justly and equitably, devoid of nepotism and corruption. There's lack of promotion of respect for human rights, lack of adherence to Nigeria's national ethical framework in the Constitution. It includes discipline, integrity, dignity of labor, social justice, religious tolerance, and self-reliance. There's lack of enforcement of the rule of law and visitations on offenders with sanctions without fear or favor. There's lack of enforcement of accountability. Next slide, please. Just rush through the last few slides. The institution responsible must be allowed to work. There are various institutions that are responsible. We just must make them work. Next slide, please. So the essential part of accountability is monitoring and evaluation, which we must pay great attention to. And the indicators that we use must be targeted, timely, trackable, and are aligned with those of the Sustainable Development Goals. Next slide, please. Yes, I think that is a thank you slide, which we cannot see properly. I cannot see, now I see it, right. So thank you very much, ladies and gentlemen. I've had to rush through, but there is time for you to ask questions and to challenge me on some of these stuff that I have regurgitated to you. Thank you very much.
Thank you very much, Your Excellency. Aid is any transfer from one country to the other, but this time around it's coming from the global south to north. Thank you very much, ma. You did so well. Our next speaker is in the person of Ambassador Dr. Mohammed Ngubdu Hassan. He is the chair of the Governing Council of HEWA, and she's the chair of the Governing Council of NOCAN, that is the Nigerian UAC Action Network, and he also is a consultant to UNDP. He is very versatile in human management and administration. He's going to speak on equity in health. He's going to speak on track changing initiatives. He's going to tell us why we should track and why there should be a change in aid. Ambassador, you're welcome, sir. You have 10 minutes to go. 10 minutes going.
Yeah, thank you very much. Are you showing my slide? Hello? Okay, what I'm going to discuss is track changing initiatives about AIDS and charity, and to see whether there have been any impacts so far. Let's go to the next slide. Sanimo, let's go to the next slide. If you are showing my slide, yes. So if we have to track, we need to know what to track. And what you see on the screen is the total amount that has been coming into Nigeria, starting from, say, from 2012 to 2019 alone. We had a total of 20 billion plus coming into Nigeria in US dollars. Our first aid receipt was in 1960, and it was a small sum compared to current figures of $132 million. And the highest so far that Nigeria has received is $3.517 billion in 2019. Now, currently, the budget that is proposed for Nigeria by UN OCHA is the sum of $1 billion to meet the needs of 6.4 million most vulnerable people amongst a total of 8.7 million people across Nigeria. Now, from my residency in the Northeast, where the bulk of these aids are being spent, particularly for the humanitarian intervention, I can testify that without the aid that came to the region, one can only imagine what would have happened to the 1.72 million displaced persons across the Northeast region. In Maiduguri alone, there were close to 21 IDPs camps, each one holding nothing less than 50,000 people. Let's go to the next slide. This chart shows from 2012, when we got 1.916 inflow, to 2019, and the figures that came into Nigeria every year is depicted, and the source for this particular data or the chart is shown below the chart. Let's continue to the next slide. So the sum of 20 billion is so huge of money compared to the budgetary spending of Nigeria between 2012 to 2019 at a time period of 7 years. I don't think any African country has received this quantum of money in dollars. So that's better. So now this underscores the need for tracking to see whether these monies are being spent judiciously. So I will attempt to show the measures that I have seen aid workers have taken to safeguard the resources humanitarians and donors have entrusted. National non-governmental organizations, UN system organizations. Can we take this up a little bit? The page is too big. I cannot see some of that, but then definitely, there are provisions made. Thank you very much. So that those people who have been entrusted to, deliver humanitarian services are doing they are offering these services very well. And some of the actions that have been put in place include constitution of clusters or sector working groups that have the technical expertise to deliver quality services. Many of the states in the Northeast have put in place humanitarian coordinating agencies, which require that actors align their interventions to the strategic plans that have been put in place by the state governments in the region. Now, they're also at the beginning of the insurgency and humanitarian interventions. There are many NGOs that came in that necessarily did not have the permission to work in Nigeria, because in Nigeria, before you work, you have to get registered by the regulatory agency called the Corporate Affairs Commission. And then later on, the Federal Ministry of Budget Planning and Finance also brought in the proviso that all actors that are coming to Nigeria must be registered by that ministry. Then came the registration requirement by the EFCC, Economic and Financial Crimes Commission, because of the perception that some of these monies may be missing or missed if they are not properly guarded. Then insistence on externally audited financial reports. These are all provisions that have been put in place by the government and also by the international NGOs that come into Nigeria, who partner with local NGOs, so that anybody with this registration and they have the externally audited financial reports and so on and so forth, will be able to provide the services that are required without necessarily, diverting the fund. Then there is the introduction of communication working group by OCHA that has added onto its work accountability framework, which is called the Accountability to Affected Population. It's a working group that is chaired by OCHA. And then the governments in the region have declared zero tolerance to duplication of intervention in the same location. So when you look at what has been happening previously, donor agencies decide where the location of their interventions will be, but then on coming to the field, they will realize that there are also organizations or other donors that are, providing assistance. So with the establishment of the coordinating agencies in the Northeast region, such duplications have been avoided, and that if where you want to plan to work, there's a similar project, then you'll be advised to move elsewhere or take the intervention to another state. Let's have the next slide. Now, monitoring of the humanitarian intervention is very, very key. We have earlier on stated the involvement of the Federal Ministry of Finance, Budget and Planning at the federal level. They have been coming into the Northeast region to check what international NGOs have pledged to do. There's the state humanitarian intervention coordinating agencies, cluster working groups. Then when actors go to the local government and the communities, there are also bodies that have been sensitized to track what is happening. This is what is happening in Nigeria currently. And so this tracking is done at all the levels. So at the community level, community members ensure that the beneficiaries that are selected by the community members because they know who such vulnerable people are. The protection, there are also child protection committees. Children and vulnerable women are protected so that the humanitarians do not exploit their vulnerable positions in exchange for aid. Then there are also official security organizations like the Nigeria Police, the Army, the Vigilante. All of these people exercise, oversight. They look at what is happening. If there are any issues, they report to the regulatory agencies. Now, within the implementing organizations, of course, there is a rigorous monitoring and evaluation initiative, which has been mentioned by the GC chair, the first speaker, and then learning activities. So data are gathered all the time for every activity until the end of the project that is taking place, and then learning is documented for future interventions. Next slide. Now, has the monitoring that has been done been successful? So my opinion is that it may not be completely successful, but the result would have been disastrous if the checks and balances put in place were in there as they are improved continuously. So the evidences exist that the monitoring that have been put in place have flagged up some cases of diversion which were detected, which were also promptly addressed. Some organizations that were involved were blacklisted. In fact, they have been sent out of the state. For example, Borno State, and in fact, even in Yobe, there were cases that were organizations that were involved and they were asked to go. And in fact, they had to go because nobody was ready to deal with them. So measures are now put in place to bridge the capacity gaps within promising national NGOs, so that when the NGOs depart, there shall be no vacuums to fill. Now, these particular measures are happening because the Nigerian intervention in the humanitarian sector is gradually coming to an end because the insurgents are themselves, surrendering. And but then we have entered the development phase, which is the next phase where we know that facilities, infrastructure, and others are to be built. There will be less humanitarian intervention, and so when the NGOs leave, definitely what is left for a humanitarian national NGOs. So there are hints already amongst NGOs that they prefer to go to the Niger Republic, where the government is less stringent compared to Nigeria. Nigeria has put in place so many checks and balances, and it is no longer game as usual. Let's go to the next slide. So in the meantime, however, fingers are pointing at NGOs and non-governmental organizations for driving the prices through the roof. The coming of NGOs has changed a lot of things in the Northeast. Prices have gone very high because coming with a lot of dollars, the NGOs, the actors are scrambling to get the best houses for their offices, the best accommodation for their staff, particularly when at a time the insurgency has made it impossible for people to look for homes away from the city center. So over 150 non-governmental organizations have relocated to Maiduguri and to other capitals of Northeast region, or they have registered new entities to come into work. Now, not all of these organizations were registered by the regulatory agencies as discussed previously. Now, the issue that the community members were complaining about was that these non-governmental organizations, are they actually coming to do an honest work and go away, or they have just come to exploit the situation? What usually was mentioned was that the rent that normally people rent space for 1 or 2 years, you see some of the NGOs will be renting for up to 10 years, and people will be saying, okay, what do you still want to do for 10 years? Still in the Northeast, you don't want this insurgency to finish, and these are the issues that the community members are saying, that the coming of the non-governmental organizations has fueled a lot of crisis, and that maybe even after they have left, definitely the high prices that they have generated, they have pushed to occur in the Northeast may remain for a long time, making the people to suffer huge losses in income, because they will have to pay higher prices for what they need. Next slide. So, why are civil society organizations preferred by the foreign government? The mention was made about initially UNICEF, UNDP, and all the UN agency organizations were preferred. Definitely, up to now, they are driving forces in the region and in Nigeria. But then, definitely, from the literature, I have observed that previously, aids were being administered by civil servants. And then the civil servants actually stopped, they could not be accountable. And so they had a previous record of corrupt practices and unrealized project objectives. There were so many project failures. So despite the fact that the community members are complaining about the issues, the problems that civil society organizations, the NGOs have caused, driving the prices very, very high and all of that, paying themselves huge salaries and so on and so forth. The donors still prefer to work with the non-governmental organization compared to the civil servants that hardly, deliver results. Next slide. So, despite this, there are still issues. The issue of best practices show that there still remains to prove that there's adequate accountability to affected population. Even though the non-governmental organizations are doing a better job compared to what the civil servants are doing, the people who are supposed to take part in the design of the projects are still not included into discussion before a project is initiated. Beneficiaries and their communities complain of not being consulted at the project idea, needs assessment, and proposal development phases. Evidences for the above is the discovery of project duplication by the Humanitarian Coordination Agency, which either stop the project from being implemented, or the actor is advised to relocate to other sites. If you don't just design a package and then come to do it like every problem. So, but then the agencies are now stamping their feet and saying that, look, you don't have to waste resources. These resources come in the name of, say, Borno, Yobe, Adamawa, or any of the states in Nigeria, and that if it has to come in their name, then they have to be consulted and taken into confidence. These are proofs of poor coordination by the actors concerned who refuse to conduct proper need assessment, databases of other actors at the proposed project locations, or simply put, security complex from the donor agencies that they claim to know what in the actual sense are outside their ability to know. Of course, this results in the intervention failing, if not implemented, if at all, if implemented. Next slide. So currently, we are seeing that instead of withdrawing and leaving the civil society organizations, national civil society organizations, who are not capable of continuing with the efforts of the INGOs, we see that there are commendable efforts by development partners. There are three that one can see that, yes, I've seen the 3 minutes, I should be able to finish. There's one from ACT called ACT British Council in partnership with EU. There's a PLR CAP, an initiative of INGO Forum and Consortium of Donors, including UKAID, UNOCHA, USAID, Government of Norway, etc. Localization Initiative. This was initiated from the Grand Bargain and negotiations in 2018 or 2019, but currently is being implemented by one of the sectors called the food security sector. It is hoped that the capacity building across the spectrum of promising national NGOs, the landscape shall be set for a more result-oriented NGO project implementation, that is national NGO project implementation that meets the need of the target beneficiaries and be able to directly access international donor funds. Next slide. Who benefits from aid? Well, we have normally women, girls, children under 5, orphans, and the aged are the ones that are benefiting. And the type of interventions are usually food rations, wet and dry, shelter, non-food items, water and sanitation, education, livelihood, and so on and so forth. So that captures what is being done. And let's go to the next slide because we are almost around as so how do we improve aid effectiveness? Discussion on the need to improve the effectiveness of aid is gaining ground, with practitioners from aid receiving countries complaining that the needs of aid receiving communities, states, and countries are determined in the international headquarters of donors and humanitarian agencies. This has to stop, or at least the beneficiaries have to be carried along. Most often donors and the officials believe that they know the problems of aid receiving countries better than those targeted by the intervention. This has to stop. Some tendencies are rooted in colonial history, which elevates poor donor expertise over and above the knowledge of the receiving countries. Evidence has, however, shown that the failure of aid grows from donor inability or refusal to consult, ask, or understand the needs of beneficiaries ahead of the rollout of the intervention. Very often interventions are viewed through the lens of northern view of what they think are needed rather than the actual needs of the people. Now, I think there is one more left, I believe. Next slide. Now, I have recommendations here, but the most important recommendation is the last one. Despite the debt forgiveness of the Paris Club during the early 2000s, Nigeria still reels under the yoke of heavy debt burden occasioned by the COVID-19 pandemic. Considering Nigeria's population of over 200 million, it can also be argued that helping Nigeria to exit it can also reduce or force international migration. Reduce forced international migration, very much discountenanced by the aid-giving countries, whose geographic space are targeted by most Nigerians and nationals of other underdeveloped countries. So the rest of the recommendations are at the top, and I am concluding by saying that it is the duty of developed nations to help Nigeria to exit aid, and this cannot be done without assisting Nigeria to resolve most of the humanitarian crises that are bedeviling Nigeria. and of course, building the capacities of both the government institutions, providing critical infrastructure, roads, railway, completion of railway, power. These are what drives countries to become developed and to become self-sufficient. So with this, I conclude my presentation, and I would like to thank you for your attention.
Thank you, Ambassador, sir. Thank you very much. I'm receiving so many chats that our meeting was billed at 2 o'clock and people logged in and we were not there. I'm
Yeah.
sending my apologies. Now, you tracked the influx of aid from 1960 with 132,000 US dollars, but as at 2020 we have had over 1 billion. So what have we done with this money? Thank you very much. So we go over to the next person, in the person of Professor Joe Anna. He is a former Commissioner of Health of Cross River State. He is a clinical expert. He's an educator, a family physician, and he's a specialist in public health. Professor Anna is coming to treat the issue of equity. Are we having common goal? Do we have equity in availability and care in health? Prof, you're welcome.
Thank you very much. Thank you very much, Madam Lizzie, for the introduction. And thanks everyone. Thanks Kampala Initiative for having us here. My topic, I think it's going to be shared shortly. It's to speak on equity in healthcare. And having been working in the area of health system strengthening for a few years now, in our center, we take the view that in Nigeria, like in other low and middle income countries, when they think about how to develop, they think of loan. Let's get some more loan. Whereas in high income countries, when they think about development and how to improve health and human well-being generally, they think of how they mobilize their domestic resources so that they are always self-reliant. We need to learn from that. Next slide, please. Next one. Yeah, I want to appreciate, as I've said before, I want to appreciate the organizers of this. And I want to thank particularly Lizzie, Bine, and Mr. Kani and Ubud for all the effort they've made to have me make this presentation. Of course, I thank all the other speakers and participants and all the sources for my presentation. And in the work we've been doing in Nigeria, from HRI Global, which used to be HRI West Africa until recently. We started this work in 1991. I was based in the UK at the time. Came back, I was brain drained and my brain returned. Since coming back to Nigeria in 2004, we've been here. I want to highlight, also thank an organization that has always supported us. HIFA stands for Health Information for All. It's an online platform that we formed in Kenya, Mombasa in 2006, with a view to making sure that patients, carers, and practitioners and their families have accurate, current information. When we formed that in 2006, we did not realize how important that was going to be. COVID-19 pandemic had just illustrated, with all the misinformation and the infodemic that has gone on, that having accurate information is very important for the patient, for the caregiver, and for practitioners. You can join HIFA at that address on the screen, www.hifa.org. It now has it's in a population of 20,000 active members, and it's in 180 countries. You are welcome to join HIFA. Next one, please. Thank you. Next slide. Thank you. So that's my topic, and I intend to look at it from the availability of healthcare services for everyone within a limited distance, so that people can have access to quality healthcare delivery to everybody who needs help, who is sick, and of course the elderly. And the discussion will look cut across health insurance, which without it, frankly, all the things we're discussing about quality in healthcare cannot happen. Every country that has achieved universal health coverage has an effective health insurance system. The reverse is also the case. A good example is the country that spends the most in healthcare, but hasn't achieved universal health coverage, has worst health indices compared to similar developed countries, and I'm referring to the USA. The availability of vaccines for polio, meningitis, and other vaccine-related diseases will also come up, and we'll talk about the challenges. We will touch on the COVID vaccines and what it means for inequity in healthcare. Thank you. And just a brief definition of health inequalities. If you browse it, there are lots and lots of definitions, but this is the one I prefer to use for this talk. Health inequality means the difference in healthcare quality across the population and between different groups within a particular society that are unfair and preventable. Those are those differences that are unfair and probably preventable. It's what we refer to as health inequalities. Why do we have inequity to begin with? It goes back to when we are born, in what fashion we grow, the environment we grow in, where we eventually live and work, and indeed as we get older, what kind of lifestyle, what kind of quality of health we have. And of course, the other bit is what our environment influences. The first speaker, Her Excellency, talked about the importance of education. So far in our environment, there's still so much superstition and alluding of illness and death and mobility to supernatural powers more than whatever the science is saying to us. So what people think, what they feel, the way they act, all of that is impacted by their mental, psychological, and physical health and well-being. And this is the nub of the WHO World Health Organization definition of what health is, referring to not just the physical health, but also our mental and psychological health. And then the dimensions of inequity, where did it go? There's the socioeconomic status of the individual or the group. Do they have an employment? If they've had employment, do they have sufficient income to be able to attend to their health needs? Do they have living wage, as some people will describe it? And do they live, where do they live? Are they in the deprived areas? And deprived areas will be defined as areas where there's a concentration of people with no or very low incomes, where housing generally is poor, where the population is dominated by those who are poorly educated or totally illiterate in some cases. And the geographical location in some parts of the world is where they have postcodes to identify individual addresses. They will call it postcode healthcare. When you live in certain postcodes, your health, the quality of health you get is better than if you live in other postcodes. For our use, when we talk about differentiate geography to, is the population urban, is it semi-urban, or is it rural? If you take Nigeria, for instance, what you might consider quality health care is by and large concentrated in the urban areas. And most of the population, about 80%, we are told, semi-urban and rural. But the health facilities of reasonable quality are concentrated in urban areas. And the same goes for the health human resources. The distribution, again, if you take Nigeria, like most of the low and middle income countries, there's an over concentration of health human resources in some parts of the country compared to others. In Nigeria, it is the southwest zone, for instance, particularly Lagos, our commercial hub, capital, that has some figures will put it up to 50 to 60% of the health human resource are just within Lagos and its environment. Whereas when you get up to certain parts of the northeast or north central, and indeed some parts of the south, you have very low numbers of human resource to deliver the care. Then there are biologic kind of characteristics that determine influence equity. The age, both extremes of age are vulnerable. The newborn and the very young and children, and then the elderly. As we get older, of course, we have more disease conditions, lots of comorbidities and so on. If you look at COVID-19, for instance, those who have the elderly that have comorbidities formed a large chunk or percentage of those who not only contacted COVID, but also died from it. And then the gender issues. Women have been marginalized for a very long time. Increasingly, we hear that effort is being made at both governmental and non-governmental levels to empower women more, so that, especially when it comes to health and education, the more women that are actually empowered and enabled with better education, better health, the better the health indices for our population. Then race. We've just been told by the first speaker that in the 1500 AD, thereabout, Africa was plundered. You can use any adjective to describe what happened to us. But that's a long time ago. And it's still going on. We'll see later on some illustration and data about that, particularly the Black race. The Black race has been suffered the most inequity as far as health is concerned. Then the disabled, people who are physically or mentally or visually, if you have any form of disability, you suffer inequity in health more than the others. In our country, in Nigeria, I can challenge you to go to any health facility, primary, secondary, tertiary, or quaternary, public or private, and look to see if any of those facilities are built or designed to be friendly, to be usable by the disabled. You probably won't find very many. And then the usually vulnerable groups that come as the society develops. We just had a word from Ambassador Ngubo, who was talking about the IDPs, internally displaced persons, who have suffered greatly from the insurgency that has plagued Nigeria for almost 10, 11 years now. And there are certain professions or work types that also, the sex workers, for instance, one of the challenges they face is the fact that they don't have access to proper healthcare. And of course, the very poor who end up homeless are affected as well. Next slide, please. So I want to make the point, this slide is, the message here is that inequity in healthcare is a global phenomenon, and it is racial, and it affects the poor to a greater extent than the non-poor. And so we will try and show that if you look at the lower part of the slide, it says the American healthcare system is notorious for the deeply unequal way it favors those with means over those without. So it favors those who already have, are in a position to provide or access healthcare than it does for those who don't have. And this disparity doesn't just affect issues of class. It also manifests in the way that the various racial groups are treated. And the message we have here is that surely this is not the way for healthcare in low and middle income countries like Nigeria. We really don't want to go that route at all. We need to learn lessons from what is happening in that place, and try and do it differently. Next slide. Again, that emphasizes or illustrates the point about the USA inequity in healthcare even more. You're using the current ongoing COVID-19 pandemic as an example of the kind of inequity that can exist in the society. Again, it points to the fact that African Americans who were whose forefathers were taken away from the original Africa and taken over to Americas have not fared well at all. And even when you compare them to other foreigners, other immigrants to the States, Latinos and Asians, the Blacks generally suffer more inequity than other races. Next one, next slide. So even in the good old UK, with its very famous national health system, the NHS, there's inequity there. And the inequities in health have existed for many decades and have led to unjust consequences in mobility and mortality. These have become even more apparent during the COVID-19 pandemic. Again, COVID pandemic has highlighted the inequities in healthcare, even in advanced countries as this. And disproportionately, the Blacks and other ethnic minorities are more affected, especially they belong to the poorer socioeconomic backgrounds and urban and rural deprived locations, and if they belong to any of the vulnerable groups we mentioned earlier, either the very elderly or disabled and so on, unemployed. But the difference is, yes, these advanced countries have inequity in health, but they do something about it. They do not look to aid. They do not look to getting more loans to solve the problem. They look to how do they mobilize local resources, use it effectively to solve the challenge of inequity in healthcare. I'll give you an example. As we speak, I mean, just about 3 weeks ago, the UK government, for a very long time, increased the national health insurance contribution across board. If anybody who has a job, you do it. But they ring-fenced it for health and social care. That's what they do over there. But what do we do in Nigeria or Africa or any other low-income country? Next slide, please. So WHO emphasizes the point that the health inequality is a global phenomenon, and it lists, you can see on the slide in front, those figures are in millions for the various conditions that lead to the causes of death due to health inequality. Next slide. And if we look at that, if you take the lower respiratory infections, children die mainly from pneumonia, malaria, diarrhea, and sepsis in Nigeria and other low-income countries. The message for us Nigerians is that we supply the over 80% as low-income countries for these deaths from lower respiratory infections. The same goes for diarrhea diseases. The message for the cerebrovascular disease is that the inequity that arises from the deaths that arise from here means that the life expectancy in our country is 34 years shorter. For instance, a child who is born in Nigeria today, or Sierra Leone, or any part of Africa, would look to live for the male for about 52 years. But the majority of them would have died. They will not reach the age of 5. And whereas their counterparts who are also born today in the UK or these advanced countries will live to 85, 86. And we know that what that means for the socioeconomic development of a country. The same goes for prematurity and low birth weight, birth asphyxia and trauma. We, as low-income countries, take Nigeria particularly, we account for majority of the deaths that occur as a result of these inequities. Most of these are preventable if there's only some action at the political will level of government to put structures in place to have a strong health system that can help to prevent them from happening in the first place. Next slide, please. This goes tuberculosis, again, totally preventable and treatable condition. But it's still rife in our environment because so we have not succeeded in linking other sectors with the health system. We are operating in silos. For instance, when you take whether it's malaria, whether it's tuberculosis, all these preventable conditions, if the environment is conducive and taken care of, there's proper sanitation, proper waste management, and all of that, you will find that these are preventable. And the few that might then develop the infection, there will be enough resources to manage them successfully. For the maternal mortality, for instance, Nigeria, with our 200 million population, the largest in Africa, or any other Black country, we account for 2% of the world population, but we contribute 10% of the maternal mortality. That is 1 in 13 pregnant women will die in childbirth. That's a scandal. Last month, about 4 weeks ago, the Federal Ministry of Health announced that last year, was it 2019, the count has come to 50,000 pregnant women will die every year. Now, when you compare that to figures from other countries, the high-income countries, for instance, there are single figures. In the UK, for instance, they're looking at single figures. The whole of Western Europe, Australia, Canada. Next one. Next slide, please. So the side effects of AIDS there are very common usages and sayings in our society that actually tells us that aid is not the best way to look at how to solve our problems. Aid is useful when we are starting, but even that aid that you get, if it's not used properly, it has sort of problems. People will say, he who goes borrowing does what? Goes sorrowing. If what you think of as a country, each time you have a challenge is, oh, let me go and borrow the money. Even before you think of tightening your belts and looking at reducing your level of consumption, reducing your appetite for things that you don't even need, then it's a problem. He who pays the piper dictates the tune. That's a very popular thing to say. So when we keep going out for aid, yet we fought these people about 60, 70 years ago to get independence, aid stops us from being really, truly independent. And so when they come in, they dictate how that aid is used. And generally, as we notice, the programs are parallel programs. It's malaria, it's the typhoid, it's HIV/AIDS. It's not about system developing and institutional strengthening. For Nigeria, the National Health Insurance Scheme has become so complicated, you wonder why. It looks as if we want to reinvent the wheel. What we're talking about is health insurance. It's about taking insurance from other sectors and bringing it to health. You buy a new car, you get insurance to cover for accidents and something going wrong. Whatever valuable you have, you think about insurance to protect loss and damage and so on. But when it comes to healthcare, in Nigeria particularly, it's very so complex. You wonder what's going on. So 16 years after NHIS came in since 2005, it's covering less than 5% of these 200 million people. And those it's covering are actually those, the percentage in the society, if anything, have some income, that the ones who can even manage to take care of themselves if things go tough. The informal sector is not covered at all. And well, Africa, we're waiting for donated COVID-19 vaccines. Again, recently, the Minister of Health, Federal Minister of Health Nigeria told us that there used to be a lab in Yaba that manufactured vaccines. So what happened to it? And now, I read it in the papers yesterday, about less than 5 million Nigerians, of these 200 million people, have been vaccinated. We're waiting for the free vaccines to come. And when it comes, God knows what we'll do with it. Other countries thrive on true independence and national pride. I just mentioned the UK as a good example of looking inside rather than going straight to the IMF or the World Bank and looking for loans. No, they increased the national health insurance. Before then, they had tightened the belts. From the Queen down to the government, down to the Prime Minister, everybody tightens belt. And then look at, they have actually, because of COVID-19, they borrowed so much to produce the vaccine, which is now helping us to overcome COVID-19. But they have already set a date that by 2025, they're going to pay off all that money they borrowed last year in 2020. That's how countries should be behaving. That's when you have the political will. And in our view, aid kills innovation, it kills research, and it's too expensive. At the end of the day, you keep paying off the interest. And even with the Paris forgiveness and all of that, it's still bad news. It denies countries ownership of their programs, of their plan, and it kills desire to do anything. Next one, next slide, please. So I'll try and be fast here now. Aid abuse and misuse in low and middle countries. We got this from going through the web, that aid isn't always used effectively in Nigeria because corruption in government and individual means that aid is lost or not given to the right people. And I must emphasize, this is not peculiar to Nigeria as a low-income country. It cuts across the low and middle-income countries. There are all sorts of political, ethnic, religious, business affiliation that you need to have to even be able to access the benefits of the aid. Even though when it is being repaid, it's being repaid on everybody's name, but only very few people have access to it. Next one, please. Next slide. Aid can be useful, in spite of all that I've said, but it should not be the main source of resources for health. We need to get Africa to begin to look at how it's going to wean itself from dependence on health aid by removing inequities in healthcare. And we recommend using a homegrown, tried and tested program we call the 12-pillar clinical governance, because it restores ownership, it restores national pride, and it actually gives us true independence, if we are really going to be truly independent, to chart other courses and to chart, to determine what happens to us in this globalized world. Next, please. So essentially, we are using Nigeria as a case report, using a whole health sector, not just the health system, but the health sector strengthening to reduce dependence on aid and reduce inequity in healthcare by increasing domestic mobilization of resources for health. Next slide. And that's the representation of the 12-pillar clinical governance. And for this talk, I'm just going to center on the policy and the law and the funding mix. The infrastructure, equipment, and utilities and ambience are all critical elements without which you cannot talk about quality healthcare anyway. But for the purpose of this talk, the policy and the law and the funding mix, it's crucial. When we first designed this in 2004, there was no National Health Act in the form of a law. It took 11 years for that to come, but in the meantime, the program had yielded a lot of benefits. A lot of low-hanging benefits came very quickly. And as soon as there was consensus and systematic implementation of the content of each pillar. And so let's have the next slide. Yeah, so using that program as a yardstick, it was very quick for us to see what was happening. And for it to happen, there needed to be political will at the maximum level. And I cannot emphasize that too much, because that's exactly what we need to wean ourselves or reduce our dependence on aid, is that political will. Nigerians know exactly what to do. You attend conferences, you listen to webinars, you join meetings, you can see that the ideas are there. For us, what is missing is that final step, that those in governance at any point in time to say, yes, we're going to do this and let's do it properly. Those are the programs that we generated and implemented under the pilots. Next slide. And importantly, of all those programs, the health in all policies policy was the anchor on which everything was based. The Ministry of Health and the health sector and the health system worked with all other government agencies and departments and ministries. And you can see with the governor's office, it was true that those of you who might be familiar with the Duke years would have heard about the Budu mountain race, international mountain race, the cable car, the longest in sub-Saharan Africa, Tina Power Business Resort, the Christmas Festival and Carnival 25. It had as part of the embedded subcommittee is the health subcommittee. The Ministry of Works, before they constructed gutters and drainage and walkways for pedestrians and all of that, there is a health subcommittee that they talk to. The Ministry of Environment and the urban development agencies, both in Calabar, Ugep, Ugoja, and so on. There was the Calabar Green, Clean and Green, famous Calabar Clean and Green epitaph was really built on that advice taken from the Ministry of Health. And it wasn't a monthly sanitation exercise. In Cross River State, sanitation day was every day. Waste management, collection, and proper disposal was everyday affair. Ministry of Agriculture, again, just take a visit to one of our slaughterhouses and you probably become a vegetarian. And Cross River State, I don't know about other states now, but at the time, it was the only state where food safety and hygiene was transferred from Ministry of Agriculture and Environment to the Ministry of Health, because we made the point that what we eat and what we drink has a central part to our healthcare. And Ministry of Education, the school health service was reactivated, and school provided first aiders and things for all those activities. Women Affairs and Social Welfare, the acronym WAAM there stands for Women Arise and Move. That was the political organization the governor used for his re-election campaigns. We mobilized that for the HIV program, and it was effective. It was as a result of the activity that we were able to, in 3 years, reduce HIV from 12% to 6.1%. Then the Ministry of Justice, quackery. Quackery is a big problem all in every state in the country, and the FCT. For the Ministry of Justice and the Information and the Cross River Media, they work closely with the Ministry of Health to develop the law that fought against quacks. Then for the Ministry of Finance, it was working with the Ministry of Health that Cross River State was the only state that bought into the National Health Insurance Scheme when it started. And working with them also developed and enhanced the Essential Drugs Program. Next slide, please. So this is just to emphasize the point that a health in all policies policy helped Cross River State to develop, to have the self-confidence, self-respect, that it was in a position of strength whenever it was discussing to donor partners or development partners. And the end result was that 3 years after all this policy started, yes, aid was still coming, but it was markedly reduced from 40% of the budget of the health sector and system to 20%. The rest, as aid was reducing, the domestic mobilization of resources was increasing. Next slide. This is just one of the Essential Drugs Program was one of that. I want to summarize now, but I think time is very short. So the result of what we did was that the whole sector and system was improved for patients, for practitioners, and for the population, making sure that there was a joined up governance when it came to reducing equity in health, and increased access and affordability. And by joining the NHIS in 2006, April, it took just 175 million naira to cover 3.1 million Cross Riverians. So it's doable, it can be done, so long as the political will is there. What that meant was that the budget of the health sector and health system increased from 458 million in 2003 to 5.8 billion in 2008. You need political will to be able to make that kind of step change, and improvement of quality across board in all the domains of quality. There was evidence to show that there was improvement. And then a culture of quality and safety was created. And we know that in our country, for instance, there's so much interprofessional disharmony, and that impacts negatively on the equity in healthcare. this program did help us to have a multidisciplinary working environment where the teams were working together. Everybody's contribution was recognized, and that helped to protect patients and support health practitioners. So yeah, it's a good thing to protect patients, of course, but it's also important that you supported those who are going to protect the patients. Next slide, please. I'll just skip that. I've talked a lot about, I think I've covered some of those already. And then to make the hospitals and to get those facilities really work in the health system, all the infrastructure things like power, water, ambience, those are taken for granted elsewhere. So why shouldn't they be taken for granted here? There was an ongoing maxim at the time. If you are a medical superintendent in a hospital and the light goes off, you better go with the light because you have no reason. You would have been provided with alternative sources, whether solar or generator, or there are alternative sources of power, which if you make sure that you maintain them, the power will never go off. The incubator will not lack power. The operating theater will not lack power. The intensive care unit will not lack power, not for a minute, you know? And it went beyond just clinical areas to public health, like the state was the first to enact the law of compulsory helmet for cyclists and motorcyclists. And of course, the immunization thing, the preventive part of care, routine immunization, not the ad hoc national immunization day. No, it was about routine immunization. So parents can take their children into a facility for immunization at their time of convenience. And of course, polio was eradicated in 2004 and it remains the same. Next one, please. Next slide. So I'm coming to a conclusion. The future of healthcare in Nigeria is difficult to determine at this point, really. But we know that if that the UHC, universal health coverage, and the SDGs are at risk unless there's a practical and sustained political will available and permanent from one government to the next. From one government to the next, not one government starts it, the other one comes and doesn't continue. In Cross River State, we're lucky that it's been continued, probably because we established a Department of Clinical Governance in the Ministry of Health that is funded, but 27% of the Ministry of Health budget belongs to clinical governance. And maybe that's why it has survived. And then we need to operationalize a whole sector reform, or not just putting health in one basket and all the others. No, we have to work together. If you're a health worker and you need water, you need Department of Water Resources. If you need access for roads, you need Ministry of Works and all that, you know. So all the sector must work together under the health in all policy. Next slide. And we've had quite a bit. For us, no audit, no aid, no audit, no quality. They must be tracking, they must be monitoring, they must be audit to make sure that the aid that we receive is properly and effectively used for what it is meant and not for individual or group pockets. So you can't do without it. Next one. And let me conclude. By mostly depending on health aid, the possibility of meeting universal health coverage 2030 or the SDG 2030, especially goal number 3 of the SDG, which deals on good health and well-being, and is closely linked to goal 11 on sustainable cities and communities. The chances are almost zero unless we're trying to begin to look at domestic resource mobilization. All this money that is going to people's pocket, we direct it better. And that way we can reduce our dependence on aid, because aid causes and sustains inequities in health across lower and middle income countries, especially in Africa, particularly because the aid is badly managed. Africa must wean itself of aid over time to eliminate inequity in health by mobilizing and deploying domestic resources, reducing corruption, and by entrenching programs like the 12-pillar clinical governance that has shown that it can work for us in our environment in this context. Next slide, please. Thank you very much.
The great Prof. Prof. It's a good day. Oh, thank you very much.
Thank you.
You downloaded it all. Development is not only about aid, and equity comes in form of insurance, health insurance, and vaccines. Thank you very much. He's a professor, he's a clinical professor, and he had it all and he gave it to us. We appreciate you. Thank you very much. So we'll bring up our last speaker with apologies, Pharmacist BC. Esheo, and you can have a whole night. Pharmacist BC is the vice chair of Live Well Initiative, and she is she's a hepatitis NGO leader in health, and she won the global change maker of 2017 in hepatitis. You are welcome, and you are given 10 minutes, but if you like, just take it as, go ahead. You're welcome there.
Thank you. Good afternoon, good morning, good evening, ladies and gentlemen, wherever in the world.
Sorry, your topic, I did not mention that you're going to speak on the decolonizing aid as it is. So you are the person that is going to conclude if we are going ahead or not with aid. Thank you very much.
Thank you very much. So I stand by all existing protocols. I want to thank the organizers for the opportunity, the CCI for the opportunity to be part of this. It is indeed a privilege. I'll be happy if the slides can be displayed now, or shall I share my screen, please? Can I share my screen? Okay, thank you. Thank you. Yes, so we are Live Well Initiative, LWI, and my topic has given to me is how can we move beyond the aid narrative. But I agree with Madam Levy that she's talking of how then can we decolonize aid and do we move ahead with it or not. My quick overview is I'm going to talk about what aid is. I know that our Honorable Minister, Professor Grange, has told us what aid is, but I cannot tell us how to move forward without telling us what we are talking about. So I'll quickly talk about what aid is, give a background, but I won't spend much time on that. And then the types of aid, who gives aid, the challenges of aid, the impact of aid, and then the importance of scale as a transparency tool, and then moving forward. I've started from the end, so I've given an answer, but I'm going to justify why. Now, before I go ahead, my organization, Live Well Initiative, is not a donor-funded organization. It is a non-profit. We've always worked in the social space, and we have always been a self-funded non-profit. So I'm not saying we should go ahead with it because we've been donor-funded. In fact, I want to share a big secret with the rest of the world. When we were starting our organization, we started off, of course, with the board of directors and so on. And we had a Swiss member of the board who had worked in the WHO for 30 years. And she just gave us a very short phrase. She said, Sean Donor Fund, Sean Donor Fund. So donor funding, as has been said by other speakers prior to my speaking, have their pros and cons, and they have to be properly weighed before making a decision. So looking at the background, you see that foreign aid was always used in the past to support client states in the developing world. And I use the word client states because the Commonwealth, for example, which we know the Commonwealth states are the British states, got their donor funding or their aid from the Commonwealth. The French colonies got their former French colonies got their donor funding from the French states and so on. So there was a bit of vested interest, that's just the truth. And then after the Second World War, the United States used their aid fund to help to rebuild Europe and so on and so forth. And then aid kept evolving from the 60s to the 80s. And then much more recently, we had the evolution of a body, a high-level forum called the OECD, the Organization for Economic Cooperation and Development. And then donor agencies decided to commit their work to developing countries, what we now call the LMICs or LLMICs, low, middle income countries. Or sometimes you also talk of some of them as being the emerging economies. Now, after that, after the OECD in 2003, we had the Paris Declaration, which now decided to talk more, look more critically at aid by aligning it positively, you know, taking ownership and then aligning it, harmonizing, managing the results, and then having mutual accountability. The question of accountability came in. So aid and accountability was not a one-way thing anymore. It wasn't just the donor giving the funding and then the recipient reporting back, but the donor too had to hold a sense of accountability to even the communities that was being given the donor funding and vice versa. And then we had the Accra Convention that tried to take this to the next level and so on. Now, in summary, when you're talking of donor funding, you're looking at the humanity of it, the neutrality and the impartiality. I think these facts came up in the other scripts too, because there's a lot of partiality, there's a lot of political vested interest, and the humanity aspect of it, which would really be the first reason for aid, donor funding, and so on. Sometimes it's downplayed for political reasons and so on. Now, I have a few pictures here. All the pictures I'm using in this presentation are from my organization, Live Well Initiative. We work in the social space. We work with very, very low, the lower income, because although Nigeria is an emerging economy, we do have the LLMI population, the lower income population, and then we have the low income, the middle income, and so on. So this is a place called Makoko. It's a blighted, low income area. This picture was taken prior to COVID. This was an antenatal clinic that we were hosting in the open space. We have a health post there being run in partnership with the local government and the Lagos State Primary Healthcare Board. And usually the nurses come in there along with the, you can see the health post in the background to the left, the lower left side of this screen. That is the health post. It's a very decent but small health post. And so we don't have enough space, and we have to put out benches and a canopy, and the women sitting there with their babies sometimes and so on. And we do the needful. It's been run in partnership with government, because this is a place where the government recognizes the lives, but the people there are just living in a shanty. It is not a recognized settlement at all. So you find that projects like this are not donor funded. Like I said, we are not a donor funded organization. And so everything we're doing is not donor funded, but we have government endorsement. We work in partnership with government. We run antenatal clinics. We have a gynae doctor that comes in once in a while. We have other physicians that come in, even though it's a blighted area, because we're not profit. We have physicians who are volunteers that come in and work with us there. Now, this was prior to COVID. And for that blighted community, talking of aid now, in our own little way, we were able to, this was World Humanitarian Day last year, we had a private sector company that came in and joined hands with us to run this program for them. So you could see those children of those poor people. They had school bags. They had there was plenty of food stuff for the women. The pregnant women had mother and baby packs given to them, and so on and so forth. So aid could be very useful. And so for the aid narrative, I would say it could be very useful, but we need to look at it critically and then jointly decide and conclude how aid needs to be given and to whom and in what way. For example, when we go to that community and we see those children going to school, carrying their backpacks, they've kept those bags. It's about a year now. This was in 2020, sorry. That label should be August 2020. So it's over a year now, and those kids are still happy with their books. This is also another program that was, this was a WHO partnered program for women of all disparities, you know, where we brought in women of all disparities, some of them low literacy women, hairdressers, physicians, nurses, cooks, cleaners, all of them in the same room. We trained 120 women of all disparities in the same room with using the same course material. And the WHO actually sent a 6-man observer team because they were really fascinated at what language are you going to use to train people of different socio-economic backgrounds, and they're going to get the message. And this was a training in for hepatitis, training women as hepatitis champions. And we have so far trained over 4,500 women from 18 different African countries. We went to Egypt to train, we went to Mauritius, we trained in Ghana, Cameroon, and so on. So I see that social work in the social space can be scaled and can be made more impactful when it is aided, but the aid must be properly directed. So let's look at the Paris Declaration, which talks about ownership, alignment, harmonization, managing for results, and mutual accountability. And then we also had the Korea-Busan partnership, and they were talking about effective development cooperation. So you see that even the donors, we have new groups of donors evolving, and each of them is saying, let's make aid more impactful, let's make it more coordinated, let's monitor and evaluate so that there is more transparency. And we need that transparency because aid as it stands today is very opaque. We can see that the Honorable Ambassador talked about huge sums of money in US dollars that have come to this country, but what can we really see what has been done with that money? So that there is a lot of opacity. So the aid challenge needs to be transparent. If it is made more transparent and it will be seen how it trickles from the top to the bottom, then the impact will be better felt. The measuring, the monitoring and evaluation will be more measurable. The metrics will be more realistic and not politically intertwined with other things. And there'll be less opacity and there'll be more impact on the population. There'll be palpable outcomes and there'll be proper impact assessment. So there's no doubt at all that Africa already has all the resources and wealth it needs to be emancipated, to be pulled out of poverty. Africa has a lot. In fact, I would almost say with confidence that Africa is the richest continent in the world. I think I dare to be challenged on that because we have the human resources, we have the natural resources, we have, even though there's a climate challenge now and the COP26 is ongoing now, we know that Africa is the least climatically challenged of all the continents. So Africa is really blessed. It has everything it needs, but it just lacks the institutions to allow for the creation of wealth. So like a prodigal, Africa is in the midst of wealth, but it is poor. That is, it has a lot of richness, but it is poor because it is not creating wealth out of that richness. And so if you look back now at the reasons for donor funding, food became security, health policy, water supply, economic migration, land reform, peace, and so on. All of these things are lacking in Africa, and that should not be the case. So let's look at some of those things that are lacking. Health policy, food scarcity, water. This is back to that little health food in Makoko. You can see here you have two patients with their babies. Funny enough, their babies look healthy because they are an aquatic displaced population, but I think the aquatic life, the fresh fish they get from the water and so on, they're still able to manage to keep their babies well. And you can see that these people, they are just regular human beings like us, and these are the real faces of the real people at the base of the pyramid, the real people that need the aid. But does the aid ever trickle down to them? I don't really think so. I don't think that it does. In fact, those people I just showed you now, they have their militants, they are an exploited population. And so when people come in, they say, oh, they've come to exploit us again. They've gotten money, they've gotten aid money somewhere. They just want to take pictures with us and go away. And that is their attitude to most CSOs that come to them, because most of the CSOs do not really do what they're supposed to do. So how can we drive innovation, even in global development, and make sure that it trickles down? Now, looking at the various groups of donors, you have the BRICS, Brazil, India, China, and so on. You have the N11 donors, South Korea, etc. You have the non-state donors, as well as non-state actors, etc., etc. An example is the Global Fund to Fight Tuberculosis, AIDS, and Malaria. A lot has been spent by the US government on that fund, but I'm not sure that the people you see in this picture, for example, they've never benefited from that fund, and they are the poor people, they are the downtrodden of the earth, they're the lowest income people, and you can see the nurse administering oral polio vaccination to that baby, and we do things like immunization, etc., etc. We give the baby packs, we do that, like I said, in partnership with the Lagos State government, and the government endorses what we're doing, because they have a lot of people there. In fact, they're about, the population in Makoko is about 500,000, and this little health post serves a population of about 3,000 women on the odd side of it. Now, I'm looking at the base of the pyramid. I'm also looking at other people, because even executives in an emerging economy like ours also have issues with their health, issues of healthcare access, and so on. So you find us organizing things like health fairs to even make healthcare more accessible, even to the lettered people who have not bought health insurance and so on. Now, there's something called the micro-macro paradox, and it's all just talking about the correlation between aid and the growth rate of the gross national productivity in all these countries that we're talking about. You find out that there's hardly any impact that is visible or measurable, or no correlation at all between the amount of aid given and the growth or the gross domestic productivity and so on. And that is just the micro-macro paradox. It is indeed a paradox which needs to be revisited. And Burnside and Dollar actually emphasize this by saying that there's only a GDP or GNP growth in developing countries with sound institutions and economic policies. And those developing or evolving countries or emerging economies or LLMICs that do not have good institutions, have poor institutions and poor policies, have less or no significant impact. Now we're talking about our own country here in Nigeria. It's $20 billion US converted to Naira. You can imagine that's trillions of Naira on aid alone. What can we point at that has been done with that? So it is just a matter of the need, emphasizing the need for good policies and good institutions. And we need to do this so that all the poor coordination, all the corruption, all the ambiguous outputs, people collect donor funding and you have outputs that are really ambiguous. You cannot really measure the output. there's very, very poor accountability and very, very high levels of corruption. And the issue of debt now also comes in because aid, some of the aid is borrowing, it's borrowed money, it's not even a grant. But even if it's a grant, it needs to be accounted for. But some of it is more borrowing, and so a lot of African countries are indebted, including our own dear nation. Now, how do we strengthen the system generally through mitigation? We can redesign aid architecture. That is, I'm going now to the solutions because we're talking about how do we now redefine or decolonize aid and redefine the aid narrative. The first thing is to redesign the aid architecture. And we need to do that by prioritizing needs. I've shown you the real faces of the real people that need the aid. Now, those are the key stakeholders. In fact, they should be the number one stakeholder. And even though some of them are low literacy, I assure you, they keep training and retraining themselves, and many of them are really, really very, very versatile. And even the low literacy ones among them, they know what their rights are, they know what the expectations should be, and they should be co-opted into PPPP, which is what we are going to conclude with. That is, the people must be involved. We are talking of public-private partnerships. Yes, that's very important, but there have to be the people. That is the key. The key stakeholder is missing, and that is why aid is translucent. If the key stakeholder is there, it will become transparent. It has to be transparent because from the top, you need to be able to see the person at the bottom. And that is where the PPPP comes in. So prioritizing the needs and placing the priority at the desk of at the place where the real people who are in need are. And then improving effectiveness, reforming public finance management. We need accountability, we need transparency, strengthening resource allocation, and then improving national policy. That's very important. So how can we make this more predictable, more reliable? We need transparency, accountability. We need mutual accountability. Now, mutual accountability means the donor has to put in place a plan, a very, very transparent plan that would trickle all the way down and which will show the donor monitoring that fund, not just giving it out, but monitoring till it drops and you hear the drop. You hear like a drop of water, you hear it drop at the bottom of the tank. That bottom of the tank is the base of the pyramid. Then you know it has trickled down there. Now those down there will also have a very efficient reverse reporting system. So the community is going to report back, oh, this is what they've done for us, this is what we have now, this is what we had before. And those things should be measurable, tangible, and visible. So funding must be impactful. Funding must be impactful, and the opacity at the bottom must be reduced. There must be reverse reporting. I have not really heard much about reverse reporting with donor funding. Reverse reporting, people collect donor funds and they collect them, maybe it's a 5-year term or a 10-year term, and they just say, oh, they got to the midway, they got to the halfway mark, and now the funding is over, they are bidding for another funding. What happened when the funding was over? What happened at the halfway mark? Yes, people do send in reports, we know. But what was the report from the stakeholders? Did the stakeholders come back to say, yes, what they promised is what we got, and this is what we've got out of it, and this is the next step? Now, if you look at foreign aid, most of the countries are very generous, but you find out that many of them prefer to give out cash grants. And when cash granting is given, it does not allow for much transparency. So what are the W's of transparency? Who gives what? How much is given to who, and for what project and where? So when you talk about humanitarian, good humanitarian donorship, the Good Humanitarian Donorship Initiative was brought about in Stockholm in the year 2000, and it's just emphasizing impartiality, neutrality, and humanitarianism, like I said at the beginning. For good humanitarian donorship, how do we ensure that? We must make sure that this woman, who is a low literacy woman living in a shanty a home built with nylon paper and cardboard on water in Makoko, built on wood in Makoko, this woman gets help, gets the immunizations she needs for her baby, like she's getting now. You can imagine that if we are able to do that without donor funding, if donor funding is given, then this type of project can be scaled and replicated. So we're looking at the keywords: replicability, scalability, and sustainability. Those are the keywords that we should be looking at. These are the low-income women. They need these things, and then how can we sustain this? So how can we move forward with the aid narrative? Is donor funding indispensable, or can we make it scalable? Can transparency be instituted? And with that, will that relief be granted in a place where there are no policies and no institutions, and the money has gone down personal pockets? I don't think such a country deserves any form of debt relief. And will the Busan policy apply here, which is what the N11 are saying? South Korea as well, they're pressing for more collaborations, for more accountability. And how, when, and where will we be able to implement this? So aid should not be a silo. That means if aid is being given, it must be transparent. Everybody must know that Live Well initiative, for example, if we now got aid, because we are not donor funded as we are now, if we now got aid to scale up our programs, the whole world needs to know that we've got so much in aid to run a program. And rather than give us everything for one village, give us everything for 20 villages, so that it will be clear that we have replicated. Don't tell us to do it for 5 years in one village. That is what leads to fraud and complicity. They just look for a few people who would connive with them. Give us that same amount and share it to 20 villages. And then when we've done the 20, instead of 5 years, after a year, give us another, and we do another 20 villages, or do the same 20 villages at a higher level. So those are the things, instead of building silos, single things that are hidden, you know. So transparency means scale. You have to scale it up. If you don't want to scale it up, then you don't want to be transparent. You don't want many actors to be involved. So scale means transparency, and transparency means scale. In the aid narrative, that is the way we see it in Live Well initiative. And aid should not be in a silo. The more the scale, the greater the impact. So there must be scale, and that with scale comes transparency. Now there are non-state actors, and many of them are beneficiaries of most aid. I saw that in somebody else's presentation. I can't remember who. So the non-state actors are those CSOs that are in relationship with the big international NGOs. Now they are the ones that are beneficiaries of most aid programs. And when they get the aid, what do they do with it? They must proliferate the aid to other non-state actors. We now need to have, just like you have LLMIC, we need to have NNSA, non-state actors. Non-state actors are CSOs that are not non-state actors like ours. We are non-state actors, and we've never benefited from any form of aid. Now, scale is needed to make aid more meaningful, and moving forward, scale must be conditional to aid. So anyone that wants to get aid must scale it up, even at a local level. If you're doing it in Makoko, then do 20 communities in Makoko. Don't do one in Makoko and stay there. Let it be transparent. Scale it up. Spread it. That's what we're talking about. Scale can be small but impactful. For example, you can do 20 small communities getting water instead of one small community getting water for 5 years. Do 20 small communities getting that water, and then when they've got it for a year, you now get more boreholes, and so on and so forth. That is the way to go. So for us, we are saying yes to aid, but it must reach the bottom of the pyramid. That aid must reach the bottom of the pyramid. For example, this is a little health post that cost us less than 2 million naira to construct, and we are running it. We're working in partnership with government. We treat all the patients free of charge. They don't pay a single penny for anything. They get their consultations, their drugs, their treatment, And we have referrals to the government health centers, as well as even to the secondary and tertiary levels of care where necessary. We also have physicians. In fact, one of our resident oncologists came in there recently to see one or two patients. So it's running, and it is running at very low cost. And we have a company that partners with us that occasionally gives us supplements, the drugs and all that. But this is just something so small which can be replicated with aid. If there was aid, we could do 20 of it within Makoko within a month, and we could do 100 or 2,000 of it. That is what we're talking about. With little money, achieving a lot with very little. That is what aid should be. Achieving a lot with very little, not achieving nothing, or little or nothing with so much, which is what aid has been so far. So, sorry, the title of this slide is covered, but talking about aid and a new narrative, we'll find out that if we can engage in innovative financing, which means achieving so much with very little funding, and then infrastructural development, like that little health post is a mini infrastructure for health. You know, technology sharing. We have a solar powered electricity panel in that space, so we have our computers, we are capturing patient data. And then you build new multilateral arrangements, and then, you know, the emerging donors will also be pleased to take part in that. So if you look at the donors, you have the state donors, that's the well-established, the big ones, the G8, you know, and then you now have the rising donors like the BRICS, the Brazil, China, India. So you have the N11, you have the non-DAC donors, which are the newer ones, Russia, the Gulf states, and then non-state donors, philanthropists and individuals, the multi-millionaires, and so on. So this is the future focus of aid. Infrastructure development, and infrastructure does not mean multiple story buildings. That is why I wanted to show us the little infrastructure we have, which is impacting between 3,000 to 5,000 lives immediately, and even much more than that within the vicinity, because we now have people coming even from other parts of Lagos to that Shanti area just to have the healthcare access. So infrastructure development with little funding, you know, the 2 million or less, you can have a little help that we cater for a community. And then technology sharing, I've talked about solar power, which we are doing there. Health, you know, health is wealth. Without health, you cannot have a good economy, you cannot have wealth, you cannot have any GDP or GSP to talk about. And then the people, the future focus must be on the people. You cannot be engaged in aid without carrying the people along. They are the major stakeholders, and they must be part of it. So it must transcend from the top to the bottom with those poor people visible from the top. It must not be opaque as it is now. And then scale. Scale is part of the future focus of aid. Aid must scale up at every level. This was a World Health Day where we got all the women you see here, including the one wearing glasses. They all came in from the low-income shanty, because that low-income shanty, some people lose their homes, their landlords send them out. They just go and live on water, you know. And these women were talking about making advocacy for hepatitis, and we brought them in a World Health Day. And they're carrying banners that we are mothers, we want the best for our babies, and this and that. That's just subtle advocacy and subtle activism. And this was a program we ran, you know, communicating out there that we need vaccination of vitamin B. So what's the way forward? Research will focus on public and private financing mechanisms with the provision of public goods, including the people. So it is not just public-private partnerships, but people-public-private partnerships. So you may have a low literacy person in the committee that is going to say, yes, we are low literacy, but this is what we need. People-public-private partnerships. And that will also help to entrench transparency, because if it's 10 million that is given to them, then that low person knows it's 10 million, and this is what we're doing. There should be emphasis on private sector involvement, because the private sector also has a lot of infrastructure, and they may be able to help. And then involve people by funding community-based CSOs and so on. So I will quickly conclude by saying that sustainability is the key word for aid moving forward. Innovation is the key principle towards attaining this sustainability, and partnerships are inevitable, but we are looking at people, public-private partnerships, and transparency and mutual accountability are a must. And I will finally conclude by saying, moving forward on the aid question, it is a yes, yes to aid, yes to transparency, yes to scale. Thank you very much for listening.
Thank you very much, Pharmacist BC. I support you, and that's why I also work with the women in the communities. Why? Because they are the people that need this support. And what we need to do is to back it up with policies, good ones. Now, we have been hearing from the global south. There's a voice coming from the global north. His name is Mr. Martins Drolly. He's the HPA coordinator for 4 African countries, for Uganda, Ethiopia, and 2 other countries. Sorry, my phone has gone off. So he's going to bring a voice from the global north. He's going to tell us what is their own assessment, impression, and impact. Thank you very much. You are welcome, sir. Please come and speak to us.
Thank you very much. Thank you very much, Lizzie, and thank you to all the people who've spoken before me. It's very kind of you to invite me to give a few reflections. I'm not going to do a presentation. I'm just going to give a few thoughts on behalf of Health Poverty Action, rather than myself, in response to some of the things that you've said. And I should say, actually, Health Poverty Action's work in Africa is led by people in Africa. I'm based in the UK, and I coordinate from the UK's side globally. But we're a decentralized INGO. We believe that leadership should be rooted in the places whose lives it's about. So the perspective I want to offer, you know, and it's for you to judge whether or not it's appropriate or relevant, is how the politics of aid and the narratives of aid are perceived, and the political impact that has on the power dynamics that create and sustain poverty in the global north. Because that, you know, is probably an important thing to bear in mind when we're thinking about how to make the case for aid, how to communicate the issues. So I think one of the main things that I take, there's so much wisdom and so much experience and so much expertise in the presentations that the people have put so much work into, and I'm grateful for that. I learned so much from it. And I think one of the big, you know, the huge takeaways for me from what you've just been saying was just the importance of these issues, the importance of the finance, you know, and the importance of it being used in ways that are led by the people whose lives it is about. You know, that it needs to be rooted in the people, and they need to have the voice and be able to show the leadership of it. So it's important, and yet in the UK, as you'll know, we've just recently cut the aid budget by 40%. It was 30% originally, and now it's been cut further by counting some of the climate change and the debt cancellation and the COVID responses as part of aid. So that's a big cut. And so why does that come about? And I think a lot of it is to do with the narrative, the labeling, the word aid. So if we were to ask most people in the global north, in the UK, what their relationship with, let's say, the continent of Africa, because not many of them know so much about the individual countries, let's say the continent of Africa, then most of them would believe that in the UK gives money to Africa. That's what most of them believe. Now, Health Poverty Action, we did a piece of work a few years ago called Honest Accounts that tried to look at the truth of the financial flows between Africa and the rest of the world. And what that showed was that $134 billion flowed from the rest of the world in 1 year into Africa. $134 billion from the rest of the world into Africa. Some of that was aid. Only a small proportion of it was aid, but about 30 billion of it was aid. So 134 going in, $192 billion is flowing out. So when you look at the truth of it, it's not the UK is aiding Africa, Africa is aiding the UK. And I remember, I think it was Joseph used the word plunder, that Africa has been plundered in colonial times. That's where the wealth of the UK was built, on that plundering, and that it's still going on. Now, I think one of the political issues that the word aid creates, that works against the cause that we've been talking about in the UK, certainly, is that it acts as a smokescreen, because it makes the UK look generous. And the UK isn't generous. The UK is stealing. Today, it's stealing from Africa. It's stealing from Nigeria through unfair trading relationships, through corporate misconduct, through debt repayments, in all kinds of ways. And the language of aid, the narrative of aid, which is so high profile, it hides that. It's a smokescreen. And that creates a huge problem in the UK. And this is why, when the aid was cut, it was popular. It was a popular move to cut aid. And the reason is that there's a lot of people living in poverty in the UK, because the UK is a deeply unfair society, a divided society, where some people have obscene wealth and some people are unable to feed their children. And to those people, to hear that even though their own income is being cut, the government can't afford to fund their schools properly, it can't afford to, they don't all have access to healthcare. You know, they're living in a terrible circumstance, and yet their government is giving £14 billion a year to Africa. And they don't like that. It makes them angry with Africa. If they knew the truth, so the language of aid divides. It divides the poor in the UK from the poor in Africa. It pits one against the other. So one of the reasons that Health Poverty Action, you know, as one part of the Kampala initiative, was very keen to support these webinars, was that it changes the language to reimagining solidarity. Solidarity is different to aid. And I'll just make one final point, because I think there's great power in language. And if we can come up with new words, a different narrative, that so to get away from the idea that countries like the UK are generous benefactors of countries like Nigeria, because that's not the truth. And instead, focus on approaching the issues of extreme poverty and its consequences through a different narrative. Now, the one that, and we're interested in learning what will be most effective, but at the moment, the thing that we think from the dialogues that we've had so far might offer the best solution is, instead of talking about the 0.7% finance being used to help the poor, instead say it's going to be used to tackle inequality. So that gets complete. If you talk about helping the poor, you think of somebody who's fine, you know, developed nations, helping the underdeveloped nations to become more like them. You know, that colonial, patriarchal feeling and narrative. Instead, if we talk about tackling inequality, it takes you to a very different place. So instead, the 0.7% budget can be to hold power to account worldwide, to ensure that tax is paid by corporations. Absolutely, to strengthen those living in poverty. So a lot of the actual activities could be the same. But from a completely different narrative. And that narrative puts people in the UK living in poverty on the same side as people in Africa living in poverty. Because today we have a minority and a majority world in every country of the world. We have billionaires in African nations, and we have people who can't, who are living in hunger in the UK. So so it could be that the aid budget, for example, we would like to suggest that maybe it could be called a global equity fund or a equalization fund or something like that. And I think we have a political opportunity that, because DFID was abolished by the current UK government, that we're very critical of, because DFID was abolished and taken into the Foreign Office, when this government's replaced at the next general election or the one after, the new government from by the opposition parties will almost certainly create a new DFID. And they've got a choice there, because they could reinstate and refocus global attention on the aid narrative, or they could create a new department with a different mandate. Now, and that mandate is important because it will spend a lot of money around the world, so the narrative underpinning it will affect the global narrative around these things a great deal. So we're trying to gather some evidence to try and persuade the opposition parties that when you come back, don't just set up another aid institution. Instead, set up something with a department with a different mandate to tackle inequality in the world, hold the global elite to account, and strengthen inequality of wealth and inequality of power. Look at focusing on the two, and measure the success based on those criteria. So, so that was a brief reflection. I'll shut up because it's been a long time. But thank you again.
Wow, that's great. So if we go into the narrative, it's a different issue. Then how do we co-create wealth? Thank you very much, sir. He came with a different angle of the whole thing, and I have learned a lot. And I hope everybody here has learned one thing or the other. So it's a continuous engagement. We really have to engage and find out if we can give it a new name or if we can co-create. So thank you very much. And here I hand over to Mr. Akane for the question and answer. Thank you very much, and good evening, everybody.
Good evening, everyone. I really enjoyed the presentations from the panelists, and I believe everyone also enjoyed the presentations. And the last speaker, Mr. Martins, you spoke very well. Thank you for putting us through all that. Basically, the webinar is all about we coming up with a new language about aid. It shouldn't be. We don't really want to hear that word, or we don't really like that word that we call aid, because it's another way of colonialism in Africa again, and mostly in Nigeria. I mean Nigeria because I'm using Nigeria because I'm from Nigeria, and we know so far so well we are still depending on aid. So it's another way of being a slave to the global South. So changing that language is very important, and also changing other languages, like Martin said. Changing the language, calling people poor shouldn't be poor. There should be a language that is that is pleasant to people. There should be that equality. There should not be inequality. So far so well. The panelists have presented their topics and they've dealt more on it. Now it's time for questions and answers. Please, if you have a question, you can show by lift of hand, and you go straight to your question, and we give you the floor. You go straight to your questions, and our panelists, they are online and they will be able to attend to your questions. Please, let's just use the next how many minutes and ask our questions and also give our contributions before we call it a day. Thank you, everybody. Please, is there anyone that has a question? We are still talking. I remember Professor Anna talking about, Professor Anna talked about disparity in healthcare delivery, and Ambassador talked about donor deciding things for the recipient. So those are the things. So we have Professor Anna. Before we come to Ambassador question, Professor Anna, please unmute yourself and ask your question. Thank you.
Thank you very much for that. And I want to thank everyone who is here, especially those who were given the opportunities to present, like myself. I want to particularly also thank Martin Drury for very thought-provoking comments that he gave to us. And my question is to him: how do you think that the WPA and Kampala Initiative and NUCAN can work together to advance the change in language from aid to solidarity? Thank you.
Do you want me to answer?
Okay.
Or?
Yeah, Martins, you have to answer that before we now go to the next question.
Yeah, okay, thanks. Yeah, and thanks, Joseph. I just saw that same question in the chat. I was just typing a reply. I think it would be good, maybe also for us to take this offline and continue to talk about it, because I think I think first of all we need, and Hamimu will be able to facilitate it, but it would be good. I'd also love to be personally involved. I think because I think what it will to change a narrative is going to require some not just good ideas. It's going to require some sustained organization. And what I feel is that we could collaborate in a couple of ways. So one is for an organization like Health Poverty Action, whose head office is in the UK, we're decentralized, but the head office is there, then we can see that it seems to us that a new language is needed and a new narrative is needed. It seems to us that framing it around tackling inequality of power and of wealth is helpful. But, the whole point is that these things should be led by the greatest stakeholders, not by us. So, our opinion shouldn't carry authority. Yours should carry more. It's a partnership, it's a dialogue, but yours should carry more. So I think one thing is to come up with, the new language is much more powerful and much more appropriate if it's come from the global south, rather than the likes of me saying, I think this is a good idea. So I think one is to co-create, to work with and show leadership in devising a new language. And then I think the other one is to work with as organization in a very organized way to get others to take it up, because those of us in this webinar don't have big budgets. The big INGOs and the DFIDs and the political parties, they do. And if they keep using the aid language, that is the main one that most of the people will hear. But I think there is potential, as I say, with the Labour Party, with the opposition parties, to get a new language taken up. I think it might be that what we want to do is to look at it at two levels. So amongst ourselves, we might want to think what our ideal language would be, and that might be around reparation, for example, and calling the aid budget reparation. And that's good, I think it should be. But I think also the language of reparation would be very hard to win politically in terms of getting it adopted by the political parties. So it might be that we also want, whereas I think tackling inequality might be winnable. So it might be that we have different levels of language. So we need a strategy. Sorry, I spoke too long.
Yeah, thank you very much.
Okay, Prof, are you okay? Do you have any other question?
Yeah, that's fine. I'm happy with that. Yeah.
Okay. Okay. So someone
Okay,
just dropped a
discussion
question
offline.
here. Then I'm going to read the question. Yeah, there's a question offline. Natalie asked a question. Her question is to the panelists who wishes to answer. Yeah, what do you think donor governments need to do to address their role in the various challenges described? That the donor government, what do you think they can do to tackle the challenges that we've identified in the disbursement of the earth that is given to our country? So is there anyone that wants to answer before we now go to Madam Lizzie's questions?
Yeah. I would like to say something. I can hear.
Can I attempt to?
I can say something.
Ambassador, please, can you handle that one? Ambassador.
Yeah,
who wants to
okay.
answer?
Yeah, I want to answer that. I have already
Okay.
mentioned one area where I said, I don't know whether Mr. Matthews will agree with that. There's the issue of debt forgiveness. There's the issue of what is currently happening, refugees going into Europe, taking the risk over the Mediterranean, and so many things. I know Europe doesn't want so many people to come to that side, and I think the governments, the European countries, particularly the developed nations, I know they are contributing a lot of development aids to Africa and Nigeria, but then I think it would be mutually beneficial for both sides to assist aid receiving countries to develop themselves. And it's not the development, the type of development that is in micro scale, as I'm saying, because you don't develop a country by giving them humanitarian aids alone. You have to make them to have their infrastructure. For example, take the case of Nigeria. Everything is costly. Transporting things from the port to the hinterland is very costly. We build the roads. The vehicles are overloaded. 2-3 years, the roads collapse. The railway is not working. And the Chinese are giving loans at a very exorbitant rate. Corruption is hurting it. Not much of Nigeria is having railway. So electricity, all these, once they are able to assist aid distributed countries to have productive infrastructure that will make the economy to work, then people will not have any incentive to travel across the Mediterranean. Many of them get drowned. It's not healthy for them. It's not good for the country. So it is a win-win situation. They should not stop at only providing aid for humanitarian and the smaller scale interventions that continue to support humanitarian intervention that may come, but then actual infrastructure development that will help the economy, that will make the other alternatives for transportation, power supply to work very well, so that people will no longer find going to Europe any more attractive. So that is my take. That's how I want to do it.
Okay. Thank you, Ambassador. And Natalie, if you have any other question, please just type it, since your mic is not kind of functioning. Now let's go to the next question. Prof. Adenika, please unmute yourself and ask your question. I know. Let's hear from Prof. Please. We'll come to you. Hello, Prof. Hello, Prof. Adenika. Okay, Madam Lizzie, please, let's go to your question.
Thank you very much. And my question is still to Mr. Martins. In this time that we know that the issue in aid in developing countries is because there's much power and concentration in the hand of the government, and less money is given to monitoring and evaluation. And the NGOs and CSOs, especially those like us, like NOCAN, like Nigerian women farmers that work in the communities, find it difficult to get funding. So how can we impact on making arguments when policies are ongoing in the formulation? How can we come out? How can the communities be aware of a policy that the government is bringing up that cannot even impact on them? How can they react? This goes to ask, how can the NGOs be funded to bridge the gap between the government and the ungoverned and the communities that need this aid? Thank you very much.
Would you like me to respond?
Okay, Martins, up to you.
Okay, thank you. Really good question, Lizzie. I would suggest two things as priority. I think, so one thing comes back to what I said before about reframing our work as being about, I think, inequality in all forms, particularly, I think, inequality of power. I think poverty in its ultimately is actually more about lack of power than it's about lack of money. You know, if you've got power, you're not going to be poor. So I think ultimately it's more about lack of power. So I think that in all kinds of programs, addressing that inequality of power should be, one of the main criteria that's part of everything. The other thing I think is a campaign to donors. So those can be trusts and foundations, they can be even corporations, they can be INGOs, and especially the government donors, the UN agencies, the governments. That I think they need a much more sophisticated tool about identify the best organizations to receive funding. So at the moment, there's often talk about using civil society rather than government, and that has advantages and disadvantages. Ultimately, it's important to strengthen the public services. That's important. And setting up parallel systems, we don't want to be doing that. So ultimately, it's important to strengthen public services. And I think, as speakers before me have said, it's important to build up the tax gathering capacity in country so that the public services can be funded from the country's own resources. But I think, but sometimes, yes, donors want to fund not through the government, through civil society for various reasons. But I think which civil society, and I think there's a lot of talk about localization, but I think localization isn't to just look at funding a local organization rather than one that's rooted more internationally or nationally isn't enough, because a local organization can often reinforce local power dynamics. So we come across that quite often with indigenous communities. An organization can be local, but it's the local, it's run by the local power holders, and the more marginalized ethnic groups don't get a say. So I think donors need to have I think they need a power analysis tool or some kind of metric to look at where the leadership is really coming from in the preparation of the proposal, the plans, and the monitoring and evaluation. So what you're saying about monitoring and evaluation, who judges whether or not it's been effective? And that should be the people whose lives it's about.
Oh, okay. Oh, wow. Thank you so much, Martin. We still have to call on Prof. Adenika. Please, if you are
her audio, she dropped the line. Her audio is not working.
Not functioning. Okay, please, you can type your question and put it on the platform. We'll see how to answer the question. Now let's go to Madam Fambisi. Fambisi's hand is up. Fambisi, please unmute yourself and ask your question.
Yeah, I did not have a question. I wanted to make a contribution.
Okay.
To that question.
Okay.
I wanted to make a contribution to the question on how donors can fund the CSOs. I think there's something called the last mile logistics. Just about to actually type that in. What you call the last mile logistics is just what it takes to get to the farthest, the most distal stakeholder. That is, it could be the poorest, it could be the physically distal person or the poorest person or whatever. So that's what you call your last mile tactic and your last mile strategy. And I believe very much that if the donors really want to implement aid properly, then they should introduce last mile logistics into donor funding, where the person at the receiver end, the last person at the receiver end, that is the most important key stakeholder at the receiver end, at the end where that project is being implemented, is involved. Last mile logistics. And when you talk of donor funding, there are many things that people need to, many requisite conditions. So that should be one of the conditions. That is, the last mile stakeholder should be involved. That is just my suggestion. Because it is too, the donor is too far up there to see that person. But if you're talking of last mile logistics, it's a lot of stakeholding that is involved. It will now involve the community leader and then the community itself and so on. And that is where a lot is amiss, because the community leaders do not necessarily engage their own communities. So if the CSO is working with the community leader, the CSO cannot run that program with the community leader, but in the community. So I think those are a little bit of extra research, like Martin said, a little more research and going an extra mile to reach the last mile before giving that grant or that donor fund. And then when the reporting is also being done, that extra mile.
Okay. Thank you, Fan. Okay.
Thank you.
Okay. Thank you, Ma. Please, do we have any other question or?
Yes, I have.
My hand has gone up.
Input?
My hand has gone up.
Okay. Ambassador.
My hand has gone
Ambassador.
up.
Yes, Prof. I'm coming back to you.
Yes. Honestly, there is something that's bothering me so much. What can the countries do? What can the countries do is of very important essence to me in the manner that I want to discuss this issue. We know there's a lot of corruption in Africa. Yes, are you hearing me? There's so much corruption.
Yeah.
So much money is stolen out of Nigeria, for example. In the late 90s, the military stole a lot of money. We are familiar with the Abacha loot. We are familiar with other loots all over. Recently, some monies were recovered, sent back from the United States, some from Sweden, some from, I think, the UK. And what we hear happening is that the country from where the money is going to be transferred back to Nigeria will be dictating to Nigeria that this is how you are going to spend the money. For example, if Nigeria wants to spend the money in infrastructure, they will force Nigeria to do social intervention. I don't know where this happened. This is our money that was stolen out and maybe given sanctuary in banks in the developed countries. In the first instance, such money should not have been taken out of Nigeria through active collaboration or countenancing by the developed countries. So what they can do, one, they should arrest these people or seize the money and then supervise how these projects are going to be done. I don't see how, because you are doing us a favor to return the money that was stolen, then you now dictate to us what happened. I remember when monies were transferred from France, The French government said that the Nigerian government must buy Peugeot 203 for the security forces. This was part of my presentation. I removed it, but it's coming now. What can they do? They should discourage flight of capital through illicit outflows from Nigeria. I don't think that is difficult to do, you know. And then we know, for example, we hear that the relationship between the French as a nation, France as a nation, and its former colonies, the conditions that were set for colonies to be given independence. They call it something. Is it there was a new MOU that was signed that these colonies will have to be repatriating their money, all their export money to France, and they cannot take more than 25% of such money. This is what is in the literature and in the internet. You read through it, you see. Then you don't expect Africa to grow, to develop. You are impoverishing Africa, and then when the money is going to be taken, you can't take more than 25%, and even that you are going to charge. France is charging them some interest rate. So it is so it's not a palatable agreement. We know how Guinea-Conakry resisted it and how France destroyed all the infrastructure in that particular. So colonialism should not be allowed to continue in perpetuity. One Caribbean minister, I think, was addressing the climate conference, and she spoke her mind about how she thinks that 1/3 of the globe should not be having all the affluence, but they are polluting the whole of the globe, and 2/3 are suffering. This world belongs to all of us, and if we are to mismanage our own resources, it is going to affect them. So there is a common humanity. So the developed nations, I think, have to live up to their responsibility. They got a lot of resources from Africa and elsewhere. The development in those countries are as a result of outflow of money and other resources to those countries. Nobody was complaining, but then I think it is now high time that there is some equity that should be allowed to play, so that gradually we will also come up, so that we don't become a problem to everybody. So that is my
Okay, thank you, Ambassador. I think that we have an adage that does say, he that detects the pipe, or he that detects pays the pipe part, something like that, detects the tune. And being that Africa or the global south or the global north, they know that we are depending on this earth. They seems to be exploiting us the more. So the global north, I mean, we should be able to rise up and see how we can do less. I mean, be less dependent on earth. It will kind of give us more power, more voice. I mean, voices when it comes to global issue. And again, when it comes to global issue like the area that we are talking about, when they know that they're the ones giving, they detect what we ought to do with the money. Like Ambassador just said, it is no longer funny. There should be a parity whereby everyone, whatever you want to do with it, even if it is for the global south countries, to also have a part to play. Maybe there should be a coffer where all the countries contribute money for aid around the globe. Everybody should be equal on that table, making decisions on that table. Who are the ones making decisions when it comes to earth? Who are the ones detecting the things? Who are the ones coming up with policies? So it still boils down to the issue that we are talking about, that we are still kind of being deprived of so many things, and we are still kind of being colonized in one way or the other. So we now give Prof. Anna a chance to also ask this question or make his contribution before we go to Aminu. Thank you.
Thank you very much, Arkan. It's a contribution to the issue of the question about what donor countries should do. And I take the view, frankly, that a lot of the responsibility lies with us, the recipients of donors. to use whatever is coming properly. In the 1995, I think it was, if you remember, those who are Nigerians amongst in this platform would remember when Mossop leaders were killed by during the Bashar regime. There was a global outcry beginning from the Commonwealth, because the Commonwealth heads of states were meeting in London at the time when this happened. And there was a policy, an umbrella policy for all donor partners to stop dealing with the Nigerian government and rather deal with the NGOs and CSOs and the non-governmental actors in the field of donors and aid and so on. Now that changed after 1999 when Nigeria became democratic again. So now in the field, those donor partners, donor governments would deal with government rather than dealing directly with CSOs and NGOs and non-government actors. But every single challenge that every speaker has enumerated during this last 2 hours, the donor governments and donor partners know about. So one of the things I think that they need to do is, because for humanity's sake, they can't abandon countries, especially the poor ones and the vulnerable ones in countries, because they have to give support and give aid. Fine, but can they bring in frameworks? Can they bring in things that ensures that you get aid today before you get the next one? You have to be able to demonstrate what you've done with the first one you collected. It is within their power to do that. They can do it. They can do it. They did it before. They can still do it. And that will reduce drastically the level of corruption that you and I notice in the development world today in Nigeria and other countries, because it's not particularly unique to Nigeria. All the low and middle income countries are suffering the same fate. That's one. So I think they need to hold governments to account before they give further aid. Secondly, every speaker here has mentioned the importance of community engagement, community advocacy, community participation. The donor partners or the donor governments can also insist that for every aid or loan that they give, that you must show evidence that the community is a major stakeholder in practice, in the field. These two things, I believe, will make aid more meaningful, will make a lot of impact, and we'll begin to see results very, very quickly. Check the governments, since you don't want to deal directly with the NGOs and so non-government actors. Okay, deal with the government, but hold them to account. If money for immunization goes missing, why do you keep pumping money into it now? You get the governments to account and then get the community at the very bottom end, those who are supposed to benefit from this aid, to become stakeholders in it. Those are the two things I believe the donor governments can do, and it is within their power to do it. They can do it. Thank you.
Okay, thank you, sir. That's a nice contribution. We now go back to Prof. Okay, we now go to Aminu before Prof. Adenike make a contribution again. So Aminu, please unmute yourself and, okay, Aminu, go ahead.
No, I'm just making also a contribution, not necessarily a question. I think the presentations have been crystal clear, but from what has so far come to, and also to echo what the professor has been saying, I think for me, and I think we have about two levels at most at which we need to do things differently. The first one is to do an introspective on us as Africans. I think it's very important to know what we can do as Africans to get ourselves in the trap that we find, that we are in. So we need to see very many collectives being done at all levels. So the free trade area, for example, that is being advanced by the African Union, some of those initiatives that are going to enable us to develop, to trade together and create wealth together are very, very critical in helping us escape the trap that we are in. But again, that may not be enough because the traps are beyond us. Some of these traps are external. Some of them stretch back to colonialism, to history. Okay, the legacies are still with us. They're still running with us. And that's how the aid concept comes in. That's why someone who feels they're kind enough, okay, they can help us get ourselves out of the situation we're in, so they can give us those handouts. I think that's when the concept in. And I think for me, that's where the narrative needs to change, because the ones who are giving us these handouts are even responsible to some of the colonial legacies that we are in. So they have accountability issues to handle with us. But for us to have those accountability issues and conversations along those lines, I think we need to have the narrative right. And I think that's where this conversation has been coming in. As long as we call it aid, it's going to be charity all the time. We're going to be, subjected to the goodwill of some other people somewhere else. But if we can change that to, let's say, a more dramatic word like reparation, which of course is debatable, then it becomes easy. We start to demand, to ask for accountability for some of the things that went wrong historically. In Kenya here, for example, we still have land rights issues. Most of the land that was messed up during the occupation of East Africa by Kenya, we still have issues. The same thing happens to Zimbabwe. Some of the chaos that is happening in Zimbabwe and even in South Africa, most of these are colonial issues. And they are still holding us into poor health, inequalities, and poverty. So these are some of the things that we'll start focusing on once the narrative changes from charity, someone doing us charity, to asking, to discussing deeper things, reparations, or probably collaborations, or equalization fund, or something along those lines. But I think the language is one part of it. It's not the whole of it. It's just one element into this whole conversation. I just wanted to make that input into the conversation. But thanks everyone. It's fun. I've been listening and it's going well. Back to you, Akan.
Thank you, Aminu. We now go back to Prof. Adenika. She has something to say. Please let us, Prof, please go ahead, give your input or ask your question. Hello, Prof. Hello, Prof.
Is her audio working now? I can see.
Yeah, she chatted us up that she has something to say.
Okay.
Hello, Prof. Okay, without much ado, we've spent enough time discussing on this issue. Like Madam Lizzie said, it is a continuous process. We'll be having more webinars on this and see how to just collaborate and see what we can do to change the narrative. This is just the beginning in Africa. There are many more to come from other parts of Africa as we progress so far. But so far, so well, we've learned so much today. And we've really learned that we want to see how to change the aid narrative. The languages that are used that comes with aid is something that we don't like, but because we are the recipient, we are the kind of beggars in court, we just accept it the way it is. And sometimes it doesn't go well with us. That's why the accountability aspect comes in. That's why the embezzlement aspect comes in. And also the community, sometimes they reject those things even before the thing starts. So that's where we are right now. And lastly, Ambassador is lifting his hand. Please, let's hear what he has to say before we now hand over.
Yes, thank you. I want to appreciate Hanimu for raising this issue of African economic integration. There is something of great concern that happened when we were trying to have a common currency in West Africa, we were almost about adopting the eco currency. And something happened. Then the Francophone pulled out. And you know that common currency would have aided trade and industry. It would have further cemented the growth of at least the West African sovereignty. And that is a very good economic block. So the challenge in the discussion that we need to overcome is how can we break the colonial barrier? How can we break that barrier of Anglophone, Francophone, this other bloc, Portuguese, you know, Espanol, all those blocks. We have to find a solution to that. And then in North Africa, you have the Arabs. So all of them have their own legacy. Some of them were Anglophone, some were French countries, some, you know. So I think the biggest obstacle to African economic emancipation is for us to find a solution to break free from that stranglehold, so that we would be able to think, free our minds and think in the best interest of Africa. Otherwise, you would still see people from all parts of the globe, you know, stultifying progress. And the earlier colonial, I don't want to say colonial myself, our partners, the earlier they realize that our continuous progress is in their own interest, the better for all of us. So that is just the addition that I want the Kampala initiative.
Okay, thank you, Ambassador. Prof. Anna, you were lifting your hand.
Yeah, I just wanted to say something to that. You know, thank you, Ambassador, for bringing up that issue about the common currency for ECOWAS. That was an opportunity for all of us in West Africa to, you know, go onto the trajectory for economic development. But then France came in, as you rightly said, and divided the Francophone and the Anglophone opinions. But we have an African Union where our leaders sit. This is why I keep hitting on the point of the political will, internal political will. These people, call them what name you want to call them, but let me call them donor partners or donor countries. They have their interest. And the interest is to continue to harvest what they have been harvesting from Africa. So we need to look inwards. That's why what Amelia was saying makes a lot of sense. We need to look inwards. What is it that stops African Union, the former Organization for African Unity and all of that? What is it that stops them? Why is it that they have a policy and the people that they got independence from almost 70 years ago come in and divide them? And by the way, this is why the slave trade lasted for as long as it lasted, because they had people who were colluding with the slave masters within the African community, and that's prolonged it. Yes, eventually the solution came from the slave masters when their governments took them on. But the way the world is today, if we just wait for these donor countries to change their habits, it's not going to happen. We need to look within ourselves and ask ourselves questions. Why can't our leaders see what we're seeing? So that when they come, bringing in all the colonial ideas or whatever, they listen to their people. The Francophone people, leaders should be able to listen to the Francophone population. The Anglophone Africans should be able to listen to the Anglophone population of Africa and give us what we want, until they are able to challenge and say to the donor countries, no, we're not going that route again, it's not going to change. If we're going to wait for the donor countries, the colonialists to change their ways, we'll wait for a very long time. This is just the input I want to make there. The answer has to come from within Africa. Thank you.
Wow. Okay, thank you, Prof. Thank you so much. Thank you, Ambassador. And we have Professor Adenika.
Yes, finally,
Hallelujah.
finally, I'm back on my phone.
Thank God for that.
Thank you. Oh, I've listened so intently to all that you have said. And honestly, I associate myself with all of with everything, particularly with Professor Anna's comments, who says that we have to look at ourselves first. We must examine how we are dealing with our own problems. I said before that we got our independence in 1960. 1960 till now is what? You all know that it's over 60 years ago that we got our independence. And what have we done? Okay, maybe we were brainwashed that, you know, we had to get the permission of the developed countries, or we have to align ourselves with developed countries and all that before we could do well for our own country. But we have had enough opportunities to re-examine our own position. Whether we like it or not, we are in the global market. And I am saying that unless we use an economical eye or an economic eye to look at what is happening in the world today and see how we can position ourselves, we'll be doing ourselves a lot of damage. I mentioned before that, you know, we have oil, but our oil is not giving us any money. Look, if only we can sell what we have at the market price, we will have enough resources. We have enough economists to tell us how to do this. I have really fallen in love with economics because I think it is one major discipline that is lacking in our own training. Economics of power. Economics, Martin was telling us now that there's a power differential, yes. But what created that power differential? It is economics, wealth. So, and we are also lucky that we have gotten in power today at the global level, two Nigerians, at the WTO and the ADB. They are actually formulating global policies. Why are we not finding out from them how Nigeria can come up and benefit from these global markets? I remember that our WTO lady said the other day that our own products they are being produced at too high a price. And so, you know, we are not going to get the right money for it. You know, these are the problems that we have. But our government is not looking at that. They are looking at, okay, we've got this money, how is it going to be shared? I honestly think that we need to look to call upon the community more, upon the youth, upon those at the grassroots level, let them know the facts and let them help us to tell the government that we are not delivering. We are supposed to have a social contract with them, but we are not delivering to them. Having said that, yes, the developed countries, they have their own self-interest, vested interest in their government, in their countries. Well, why shouldn't they? Why shouldn't they? But it is up to us to make sure that we call them out and we let them know that whatever funds we have, we are trying to utilize them judiciously. Thank you very much. I think that was exactly what you have all said. So I'm not going to spend a lot more time talking about it. Thank you. It's
okay.
Yeah. Yes. Thank you for allowing me to ventilate my anger.
Thank you so much. Thank you so much, Prof. Thank you so much, Prof. I think we'll be having a frequent engagement based on this. And at this point in time, I think we've spent so much time. So I'll hand over to Lizzie to continue so that we can call it a day. Thank you, everybody.